just want to start and say that I know everyone says there's really no stupid questions, but that's like one of my life mottos, because if you haven't been taught something, you don't know it, simply. So feel free to ask any questions. I have no judgment for what you may or may not know. And yeah, if you were never taught to floss, you can't know how to floss. So I'm here to teach everything and anything about oral health. So our objectives for today are to be able to describe periodontal diseases and carious lesions, recognizing the preventative measures for each, identify the connection between oral health and overall health in your daily life, and demonstrate correct oral hygiene techniques. So, did you guys know that 90% of adults in the United States have had or currently have cavities, which makes it the #1 most common disease in the US? Crazy. So, what is tooth decay? Tooth decay or carious lesions happen when the pH of the mouth is too low, meaning the pH is acidic in your mouth, and the normal pH of the mouth is between 6 to 7. A pH of 5.5 can demineralize the outermost layer of the tooth, which is called enamel, and the layers below that are even softer, so they'll demineralize even sooner. And there's 2 ways that acidity can enter the mouth. One way is simply by eating acidic foods, which is like coffee and soda. And then the other way is through harmful bacteria in our mouth there's harmful bacteria in our mouth that produce acid, and the bacteria uses sugar as fuel and leaves the acid behind. So it eats sugar, poops out acid, and then the acid on our tooth starts to break down the structure. And that is how you get cavities. So saliva. Saliva is the best part of our mouth. It flushes our mouths, it breaks down food, and it raises the pH. Saliva is great at doing its job when we help it out. Saliva can't just... Hi. Do you have a question?
Yeah, so I tried to get in contact with the, I think it was the VP of the Student Association yesterday, the day before, but I wasn't able to actually get in contact with her, so I was just on the stop line. Go ahead.
Okay. Okay, so if we eat sugar a couple of times a day, like in our meals, saliva can keep up with that, and it's totally fine. It can raise the pH, and we won't really get cavities. But if we like sip on soda or coffee or eat frequent sugary snacks throughout the day, saliva can't keep up with that, and the overall pH in our mouth is lowered, which causes cavities. Another thing to know is that if we take medications that cause dry mouth, which a ton of medications do, then that can also make you more susceptible to cavities, because your saliva isn't there to help do all of these awesome things. And if you're thinking, that's probably me, it is, because everyone answered on the pre-test or pre-survey that they eat frequent snacks or sweets. So keep this in mind. So this doesn't mean that we have to cut out sweets and soda and everything, but there are a few things that we can do to help make sure that our mouth has a higher pH. So one of the things that we can do is brushing twice a day, like I'm sure most of you know. But one thing that I didn't even know until hygiene school was that the most important time of day to brush is right before bed. So not just like after you eat dinner, but right before you go to sleep, because otherwise, like if you brush and then you have a snack or something after, you're still going to bed with all of that acidity and all that sugar on your teeth, and then you sleep all night long, and it just eats away because our saliva isn't produced as much at night. So brushing and flossing right before bed is the most important time of day to do it. And then, like I said earlier, drinking and rinsing with water helps the saliva out, helps to raise our pH. And then you can also reduce your acidic foods and eat more basic foods. And some of those are like milk and cheese and nuts. It's also better to eat all of like your sugary stuff right at once, versus eating it throughout the day. So. Okay, next, did you know that 50% of adult men and 35% of adult women in the United States have periodontal disease? Periodontal disease is the #1 cause of tooth loss in adults. I feel like most of the population doesn't even know what periodontal disease is, so the fact that this high of a percent of people have it is pretty crazy. But I'm going to teach you guys what it is. And the good news about those diseases is that they are all 100% preventable. You just have to really take good care of your oral health. You'll be good. So, what are periodontal diseases? Periodontal disease is an umbrella term that can either mean gingivitis or periodontitis. So, gingivitis is also known as gum disease. It is when plaque, which plaque is just bacteria all colonized together. So, plaque causes infection and inflammation in the gums surrounding the teeth. Common symptoms of this include swollen gums, bleeding with brushing and flossing, and redness. And then periodontitis is when you've had this for an extended amount of time, so much so that the inflammation has caused the bone around your teeth to recede away. It's like if your gums are super swollen and infected, the bone by your teeth doesn't like to be near that, so it starts to move away. When it moves away, this can cause the teeth to be loose and eventually fall out. So, another thing about perio is that it is irreversible, so once that bone starts to move away, it can't grow back, and it isn't necessarily painful. So a lot of people don't know that they have it, and they don't think that they need to go to the dentist because they're not in pain, but they still have this disease. So here are a few pictures of what gingivitis might look like. You can see this one, it's a little more obvious that it's swollen. This, pretty obvious that you can see the red, but this looks pretty healthy. Honestly, this is probably what my gums even look like, but you can see that there's this slight swelling around the teeth and a little bit of redness. And periodontitis, this is obviously a super severe case, but there's different stages of perio. So, another thing here, you can see that the gums have receded away, but sometimes the gums don't recede, the bone just does. So the bone can be moving away, but the gums are still there, so you can't necessarily see that it's moving away. Yes?
So when your dentist says like you have a receding gum line or something like that, like is this what he's talking about?
So
Or is that a separate thing?
go back. It can be.
Hypothetically.
So-
I've never been told that, but I'm worried that one day I'll get told that.
On my lower teeth down here, there's different, like, obviously genetics play a lot into our mouth, like everything else. But my gums are naturally a lot thinner at the bottom. So, like, eventually I'll probably need a gum graft right there just to boost that up. So, receding gums it can either be caused by this, that's like one of the main causes, but it can also be caused from like brushing too hard. We'll talk about like the best way to brush, but if you have like a hard bristled toothbrush or you're like really scrubbing, it can cause your gums to move away. But gums moving away doesn't necessarily mean the bone is moving away. Yeah.
I have a question. You mentioned like hard bristle toothbrush, but like in the store there's like different berries. So like which one for each situation? Like how do you choose?
Yeah. We recommend soft or extra soft for everyone. Hard bristles really only exist because that's what it used to be, and elderly populations are really attached to their hard bristled toothbrushes, but never get hard bristles. Yeah.
So can your risk of getting these diseases, like what factors besides like is there like genetic factors and other things that make you at risk as well?
Yes, we'll talk about a bunch of those. Okay, so great, you guys were right on point. Do you guys have any other questions so far? Okay, what are caries lesions? Does anyone want to explain to the group what they are? talk to your partner about what caries lesions are.
No, that's the gum disease that's irreversible because that's the bone that the period and then the
And that's where cavities come from.
Yeah,
I
I love
think-
that.
I think the I feel like so about that
Oh,
I think it's just we were talking about like
Broken down.
Bacteria in your gums. Okay, put it that way.
Okay, awesome. I heard some really good stuff. So caries lesions, like Julia was saying, that's when the acidity breaks down your tooth. Caries lesion is like the professional term for it. Cavity is when the caries lesion, the decay has gotten so much that it causes an actual cavitation in the tooth. So like there's a hole in your tooth. So that's what caries lesion is. That's what a cavity is. And then the difference between periodontitis and gingivitis, it comes from the same stuff, but gingivitis is more of the beginning stages where it's just in the gums, and then periodontitis is when that has extended into the bone and the bone has started to recede. Okay, risk factors for periodontitis, which we call perio. So stress has been shown to speed up the rate of destruction in periodontal diseases, which, yeah, it's crazy. This is something that applies to you guys because the pre-survey that you filled out, everyone said that they were stressed at least weekly, if not daily or all of the time. And then the number one risk factor for periodontitis and oral cancer is smoking. And this doesn't just include cigarettes, it also includes smoking marijuana and vaping, any form of smoking. So how does perio affect me? This is one of my favorite ads. I saw it as a little kid and it really stuck with me because you notice his tooth, at least for me, I noticed his smile first before I noticed that he has a missing eyebrow. But even if you guys are scared of losing teeth, perio also has an increased risk for heart disease, stroke, type 2 diabetes, Alzheimer's, arthritis, and pregnancy complications. So the bacteria and pathogens in perio that eats away at the bone are the same bacteria that has been found in many of these diseases. So this is a little graph of some of the things that perio has been shown to have a link to. One thing that's interesting is respiratory diseases because you can inhale those bacteria and get like pneumonia and other things, which is a super common cause of deaths in hospitals, like people on bed rest and stuff. And then one thing that I think is super, super interesting, this just showed up on my Instagram feed yesterday. So it's a study about Alzheimer's, and it showed that it might have more of a direct relation than people think because they've guessed for a while that it might be related. But this study, I will read it to you. It says, emerging research suggests that Alzheimer's disease may be linked to an unexpected culprit, gum disease. A study discovered the presence of Porphyrominalis gingivalis, a bacteria responsible for chronic periodontitis in the brains of deceased Alzheimer's patients. Researchers found that when mice were infected with the bacteria, it colonized their brains and triggered the production of amyloid beta, a protein commonly associated with Alzheimer's. This evidence strengthens the hypothesis that the disease could have infectious origins rather than being solely a neurodegenerative disorder. The study also revealed that toxic enzymes from the bacteria were present in individuals who had Alzheimer's-related brain changes, but had not yet been diagnosed with dementia, suggesting the infection may begin years before symptoms appear. So, how do you guys think that maintaining oral health and may impact overall well-being in your daily life?
I'm afraid of getting Alzheimer's.
Me too.
So brushing my teeth would make me less worried about that.
I love that. Okay, we're gonna play a Kahoot game.
Oh,
And Sam, to answer your question from earlier, you're asking more about how genetics affects getting perio. It matters less about like getting it, but your genetics can play a role in how quickly the disease progresses and like how susceptible you are to it. So. Hey, Brad. Good job, Brad. So, periodontitis, #1 cause of tooth loss in adults, which is not a function of saliva. Nice. So saliva does raise our pH and it flushes out our mouths as well as breaks down food. Removing plaque has to be done with like toothbrushing and flossing, which we'll talk about later. At what pH does enamel start to break down? Nice, good job. So teeth, or the normal pH of our mouth is between 6 and 7. That's like where it rests at. But enamel starts to break down at 5.5. And then the layers underneath enamel can start to break down even sooner, which is concerning because that's getting pretty close to the normal pH of our mouth. But like we talked about receding gums earlier, when our gums recede, it exposes the root surface, which is a softer material, and it can be more susceptible to getting a cavity. Sam, you're staying on top. Which food is the best for our teeth? Good job. I don't think potatoes are necessarily bad. I just threw that in as an answer. But cheese has more of a basic pH, so it helps our saliva out in raising the pH of our mouth. Wow. So which one of these two is reversible? Wow, I'm so proud of you guys.
sorry.
What is the #1 risk factor for periodontitis and oral cancer? Good job. Which of these has been shown to have a link to oral health?
first place.
Good job. All of these have a link to oral health,
On the bottom.
Alzheimer's, heart disease, and pregnancy complications.
Oh, you're welcome.
So why do researchers believe that Alzheimer's and perio are linked? Nice. They have the same bacteria, P. gingivalis. Okay, stress slows down the rate of disease progression, true or false? Good job. Stress speeds up the rate of the progression. True or false? Maintaining good oral health can improve overall health. Yay! Good job, guys.
Never get talent.
Well done. Nice.
Word out loud.
You guys want toothbrushes?
Yes!
The soft bristles?
They're hard bristle ones. She's here to wreck you.
Just gotta get rid of them.
That, yeah, that's the joke. Joke.
I would be like this.
No.
No.
But you didn't take the pictures. Yeah.
What was it?
Thank you.
You better bring it.
What's the,
We're learning about it.
what's the award from?
What's a sitter?
You might get Alzheimer's. I'm so sorry.
Okay. Okay, I'm gonna give a super quick summary to you guys about what we talked about so far. So we talked about, actually, do any of you guys want to give a summary to them about what we've talked about?
The winner.
I did.
He got third.
I got third.
Sierra.
How about one of you tell them about carious lesions?
I think that's when I walked out. 'Cause I don't
Okay,
even remember
Julie,
that
you're
one.
up.
Oh, okay. Carious lesions are when bacteria produce a lot of acid in your mouth and it starts to eat away the top layer of your tooth. A cavity is when a carious lesion gets really bad and it goes too far into your tooth and creates a cavity. Eats away the lower layers.
Amazing. We want to talk about gingivitis.
Colby does.
You got it. I got it.
That's when your gums get red and like inflamed, right?
Yeah.
Yeah, breath stink.
Yeah, so gingivitis is when bacteria have, like, it's when plaque and bacteria have colonized onto your teeth and they stay there for a little while, and so it causes the gums to become inflamed and irritated, and it's an infection in your gums, basically. So anyone want to talk about perio?
Perio is when it gets really, really bad and your bones, to get away from the disease, start like moving away and your teeth start falling out because the gums and the bones move away from the teeth.
Yeah, so good. Yeah. And perio is the #1 cause of tooth loss in adults, and it's super, super common. It's not super like painful or anything. It has the same symptoms as gingivitis, so like swollen, bleeding gums, but it doesn't necessarily hurt. So a lot of people don't know that they have it, and they won't go to the dentist until it gets super bad and their teeth are wiggly and on the verge of falling out. Does anyone want to talk about how perio relates to other parts of the body?
Yeah,
Or chair
you
from-
can get lung diseases and because there's bacteria in your mouth, so when you like breathe in, that bacteria goes into your lungs and you get like what's that disease where there's a bunch of liquid in your getting yeah.
It might be connected to Alzheimer's.
Connected to everything pretty much.
Yes, pretty
and pregnancy.
Do you guys have any immediate questions? It's actually been shown to cause like early pregnancy or early birth and preeclampsia. Pretty crazy.
Also throw away your hard bristle toothbrush.
Yes.
Soft only.
Is an electric toothbrush, it's still soft?
Yeah.
right? Okay, it just moves really fast.
Yeah. Yeah.
Sorry, I was thinking about that.
It's like when you have a headlight, you know, when you get your brush, you like clean up the headlight. If it was like hard, it would like eat at your headlight. But you get the soft one, it still moves really fast, but it's soft. Or you get a soft brush.
It shows the red light. It's like, no, you're brushing too hard.
I love that. So does
It's
mine.
really good for
Yeah.
I
It's
need
nice.
one of those.
So we're gonna talk all about how to care for our teeth now. We've learned about these intense things, but like I said earlier, it's all preventable. So we're gonna talk about how to prevent this. So plaque, like I said earlier, is the enemy. Plaque is when the bacteria all colonize and team up together and cause the infection in the gums, which then spreads to our bone, and then different bacteria causes the cavities. So we want to get rid of the bacteria, get rid of the plaque, and you can do that through brushing and flossing. But when plaque is left untouched, the minerals in our saliva calcify it and it becomes calculus. So calculus is what I remove. That's like pretty much my whole job is to remove calculus on the teeth. And if you have calculus built up, it's pretty much impossible for you to remove on your own, like through brushing and flossing. That's why going to a professional is so important and making sure that you get those off. So let's talk about brushing. It's recommended to brush your teeth twice a day for 2 minutes each time. And brushing your teeth before bed is the most important time. And then I'm going to show you guys a little demonstration of the best way to brush your teeth. So one thing that I didn't know until hygiene school is that you're supposed to point it towards the gum line a little bit and get your gums while you're brushing. I'll go on this too. So there's a little area of your gums that isn't attached to bone. About like here, it gets attached to bone, but up here, it's not. These teeth come out, and food and bacteria and other things can get stuck in your gums. So you want to make sure that you're pointing your bristles towards your gums to get all of that stuff, and then you can do circles. You can go back and forth. You can even add a little flick if you feel like there's extra stuff in there. You can get it out like that. But what's really most important is making sure that you get every surface of every tooth. There's been people who've come into the clinic who didn't know they were supposed to brush the tongue side of your teeth, which, like I said earlier, if you haven't been taught it, you don't know. So make sure that you get every area of every tooth, even the very back of those last teeth, which can be kind of difficult, but make sure you angle your brush back there and get every surface of every tooth. Who wants to try it out? Let's see your best brushing skills. Like,
Or like,
Left-handed.
okay, I'm just making sure.
Yeah, for
10 out of 10.
I'm gonna untangle it.
So proud of you guys.
Get that back.
Well,
Oh,
Good job.
You
don't forget.
get on work here.
What about all the top ones?
We're angling, right? And then you're feeling really crazy. You can flick it.
Wait, there is no stupid questions. Is there more teeth on the
Right, see
top or
this?
the
See
bottom?
the circular motion?
It's the same amount on the
You do
top
that
and
back.
bottom, but
The angle's important. You get all
they're,
sides
so
of the teeth.
your wisdom teeth are pretty like unique. Everyone has different wisdom teeth.
Try that on.
It's like
I wanna try the top.
I got 5.
4, you can have 5, you can have just 3. And a lot of times the wisdom teeth
Where was the
grow
other one?
instead of
You have
growing.
the two
Next
on one
to-
side?
yeah.
So wisdom tooth
Well,
here.
against it.
I just make
Yeah,
a
that's why a lot of them have to be.
Yeah.
Because if you
Some
don't
people
choose
grow in
it-
well with those.
Yeah, yeah. Some people it grows in and it's just an extra tooth back there. They still might recommend to get it removed because that's a lot
So he gets
of, that's like far back there that you have to do. But if you don't remove it, it will end up like,
I'm scared my kid
like, it's all absorbed in the tooth next to it. So,
Okay.
Angle your brush
It's there.
towards the base.
She's angled.
Okay. Together.
super, super good. And then, like we said earlier, soft bristled brushes and not too much pressure. And then, if you're using an electric toothbrush, you can just hold that on each tooth. A lot of electric toothbrushes will tell you, like, if you're doing it too hard, but you can just hold it because the toothbrush spins in and of itself.
I didn't know that either. I thought you had to still brush.
No, you just hold it there. Make sure you're getting every tooth, but yeah.
That's so easy. Is electric or manual better? Is there like a study on that?
I was told that the
There's-
electric one.
There's lots of studies. If you're doing perfect manual brushing, then they're the same. But a lot
Yeah.
of people don't, and so in that case, electric is usually better than most people.
Brush your tongue.
Yeah, brush your tongue. A lot of bacteria can get stuck in your tongue.
How long do you take your toothbrush on?
So if you're brushing for like 2 minutes, I do my electric toothbrush buzzes at 30 seconds each time. Yeah. Maybe, I don't know. So I try to do like 30 seconds per wad, if that makes sense. So I like to split it up. This is just how I do it. This is literally just my personal way. But I take my electric toothbrush and I hold it here and I count for 2 seconds on each tooth to make sure I'm getting like an even amount. And then I'll go and do, it'll buzz for 30 seconds and then I'll do about that much on each tooth. And then I do a little bit extra to get my top.
What toothbrush do you have?
I have the Oral B. Oh, twins. It's a good one. Okay, does anyone have any questions about brushing? Great. Now let's talk about flossing. Floss is low-key the worst. I hate floss personally. I've never been a flosser, even while learning all of this through dental hygiene school. Like, I still couldn't bring myself to floss. But there's a lot of different materials that are out there that are great for everyone. So there's something out there for everyone. One thing that I really, really like is water flossers. If you've been my patient, I've probably recommended you water flossers because they're a lot easier in my opinion. But a water flosser, we'll just pretend that the toothbrush is shooting water. You just can place it in between each tooth. I like to kind of follow my gums and it flushes out all of the bacteria and extra things that are in there, and it's way easier than flossing. But I'm gonna teach you guys the best way to floss if you love your gums. And then I'll give you floss. So the reason that we need to floss is because the toothbrush bristles can't reach in between the teeth. Obviously, you can see there's all of these little crevices in between the teeth. And floss does two different things. It helps to prevent cavities where the teeth touch, but it also, down in the gums, helps to remove all of that stuff that gets stuck down in there. So, if you take your floss, you want to go in and make sure that you're thinking about the area as two different teeth. So you want to wrap around this tooth, and then you want to wrap around this tooth, and make sure you're getting all the way down in the gums and pulling it out between the contact of the teeth. And then if you use like floss picks, those aren't as good as string floss because you can't really wrap it as well, but still try to think about it the same way. So like if this is a tight floss pick, try to get this tooth and this tooth. Who wants to floss? Asher.
I love flossing. I do it every day.
Yeah. And then there's also a lot of other types of interdental aids that you can use. So if you have like a space in between your tooth, like I showed that picture of perio with the receding gums earlier, obviously floss isn't going to work super well because there's way too big of a space for string floss to work in there. So there's little brushes that you can twist in between the different teeth, and that works a lot better for people with like open contacts like that. So if you ever have any questions about what type of floss or not floss you should use, I'd love to have a conversation about it. So let me know.
I have a question.
Yeah.
So I was recommended to start doing water flossing. How does that work?
Yeah, so water flossing, the machine will shoot the water down into the gums. You kind of just point it down there, and it helps to flush it out. Water flossing, I've read a bunch of studies about it, and water flossers can actually reach even deeper than string floss because it doesn't just reach like the spots that it hits, because the water goes out and flushes even deeper. So if you have like deeper pockets, water flossing can be even better than string floss. But yeah, you just follow along the gums with the water flosser, and it rinses it out.
You just hold it to the front and then like screw it like.
Yeah, I should have brought mine to show you guys, but it's normally like kind of pointed like this, and then you just like point it here.
Go in between.
Yeah, and then I just follow my gums, and then I hold it for a second, and I kind of go up and down the tooth, and I follow my gums, and go up and down the tooth. All the while, this is like shooting water, and you just hold it. There's some different like attachments for water flossers that are good for different types of people. So like if people have perio and they have deeper pockets because the bone has moved away, then there's tips that you can get that you can stick into the pocket to go even deeper and pop it out.
Hi.
Hi.
Is there a spot you want on this?
Just set it right there, honestly.
Thank you.
That's mine.
Yeah.
Is it bad if your gums like bleed while you're flossing? Is that a bad
So that is just a sign that you probably have gingivitis. So the more it's okay. The more that you
Maybe you're
like
just
brush
going
and
too
floss, the better it will get. But like I said earlier, if you have calculus in between your teeth, so like I've had a bunch of patients who have come to me who are like, yeah, I brush and floss multiple times a day, but they like had a period of time where they didn't, right? And so calculus built up, and then even though they started brushing and flossing regularly, that calculus is still there, and the calculus really grabs on to plaque and bacteria, and it like stays there, so you're not going to be able to clean effectively if that calculus is there. So that's why you go to the dentist and they remove the calculus, and then after that you should notice a big decrease in the amount of bleeding and stuff.
How often should you go to the dentist to get your calculus removed?
So it totally depends on the person, but minimum is twice a year, so every 6 months. But if you have gingivitis or people who have perio are supposed to go more frequently, because then you can really get that disease under control. So people who have perio are normally on a 3-month schedule. Yeah. So we were just talking about this, but this is why consistent professional care is so important. The hygienists want to remove all that calculus and help you out, and the dentists want to spot cavities before they get too big, because if a cavity is on your tooth, no matter how much you brush, it really won't stop the cavity. It'll just keep eating away at your tooth. You have to get that fixed. So these are some pictures of some of my patients that I've had, and they all give me permission for these. to be
Which one
here.
is
But
Kylie?
This is like calculus that you can see all around its teeth. And then this is after I cleaned it all up. This is a lingual bar from like ortho. These, yeah, I used to. They really grab onto calculus a lot. You can see it like here. These aren't the best pictures, but this is after. And then this one, I don't know if you guys will be able to tell, but can you see how like inflamed and swollen this is? This was like 4 weeks after I cleaned it all out, so you can see how it's a lot more tight on the tooth and a lot less swollen. So that's really awesome because we removed all that calculus out from there, and then he started doing his brushing and flossing. You can see that he's getting a lot better. Right here, you can kind of see a little bit of recession that we were talking about earlier. This gum has just started to move away a little bit. So, how can proper oral hygiene techniques contribute to maintaining optimal oral health? Talk about it with your okay.
If you don't do any hygiene techniques, you're gonna
It's just like cotton.
But like before it was just like, oh,
like how much
I get it. You don't really know how to do it. So now you know. Like,
Yeah.
That is just awesome.
Pretty straightforward.
Yeah.
They're gonna go to the dentist.
Alright. Do you guys have any other questions about this or about anything that we've talked about?
How often should I replace my toothbrush?
Every 6 months. So, if you go to the dentist every 6 months, they'll give you a new one.
Is it okay if you do it sooner?
Yeah. It's either every 6 months or as soon as the bristles start to like flare out, then you want to replace it.
Okay, hypothetically.
Yeah.
You go to the dentist after being a very vigilant flosser,
Yeah.
and it's the first time you've gotten the most cavities. Is that a fluke? Because then after you don't become as vigilant of a flosser, and you get a lot less cavities.
Just
Is that just
Yeah.
random?
That's
Or-
a valid question. So, cavities, it kind of depends on where they were at. Flossing, I think flossing is more to prevent perio and gingivitis than it is to prevent cavities, because
Okay.
the only area that floss helps with cavities is like right where the teeth are touching. Everywhere else is all trying to maintain like your gums and your bone health. But cavities, like I said earlier, once they start, no matter how much you do it, like how much you brush and floss, you're not going to be able to stop those cavities from getting worse.
Okay,
Because
yeah.
once the decay is in there, it just starts
And the lower
going.
layers are softer anyways. so-
Exactly. So, yeah, so smart. But
Classic.
I would assume like since you got those cavities fixed, then even though you stopped flossing, those cavities were fixed, so you didn't get more because that bacteria was gone.
Yeah, that makes sense.
You guys have any other questions? Okay, awesome. Well, these are my resources.
Nice.
And if you guys have anything else, you can just text me. And then you guys, if you want to take that test again, and then send me your before answers and your after answers,